I think it's important to start that free testing has been available throughout our community, and there have been local efforts underway for several weeks, up to a month or more, to expand that testing through the existing health infrastructure that already exists. So in particular, through both our community health center network, as well as our private healthcare sector. And the testing that has started today has been a statewide effort, as you noted, in particular to stand up some mass testing sites that are supported through the National Guard. And with 2 sites being situated within Milwaukee County, one on the north side and one on the south side of the city of Milwaukee.
And can you tell us where those sites are and how those particular sites were chosen?
Certainly. So the north side site is at the Midtown location, which is at 57th and Capitol, and the south side site is at the Umos location, which is at 27th and Chase. And those sites were determined both strategically, geographically, to capture the parts of our city that may not have had as ready access to free testing across our city, as well as the places geographically where we're seeing the largest increase in positive tests.
And this was a small point of confusion. Is the testing, the new expanded testing at Midtown and Chase, is this only for African Americans or Latinos, or is it open to anyone that's interested in getting a free test?
No, certainly there are no prerequisites for obtaining the testing, either in terms of having an appointment or fulfilling certain criteria to come and get tested. The things that we're really trying to message are that everyone is welcome, no matter where you live, no matter your insurance status, no matter what. We just want to increase access to testing for all.
And in the past, it was that people had to get screened before they could actually get a test. Is that still the case or no?
So screening for symptoms within individuals is still certainly a priority. In fact, we really want to emphasize that anybody who is experiencing symptoms, even mild, should seek testing and should have testing available to them. For this large push through the National Guard and the 2 community testing sites this week that have just gotten underway, we wanted to remove any additional barriers. And so what we're really hoping is that there will be a large turnout and that we're really better able to understand after this testing effort what the true prevalence of illness in our community is.
And who would you recommend take advantage of this new expanded testing?
So as I emphasized, this type of testing, which is really intended to tell an individual whether they are currently infected with coronavirus. It detects the actual RNA of the virus. That testing is best in individuals who are currently symptomatic, even mildly so, because it will let them know whether the symptoms that they're experiencing are actually due to coronavirus. There may be some other individuals who might not be experiencing symptoms, but for whom testing could be considered an appropriate thing to seek out at this point in time. And those would include individuals who may be living in a household with somebody who has recently been diagnosed with coronavirus. So those who are at very high likelihood of contracting the illness themselves, or who work in a setting where there has been a recent outbreak. We are not encouraging individuals who have been isolated in their houses, who have remained healthy without symptoms, to seek testing, because we just don't think that it would probably be truly beneficial to them. However, we are not turning anyone away at these sites either.
And I think you make a good point. That leads me to my next question on there's no test that can say if you've already had the virus. It only says if you currently have it, correct?
Well, there are some tests that are being developed and that are starting to become more widely available that can indicate whether an individual has had and recovered from coronavirus. Those are blood tests that are not as widely available as the nasal swabs that we see today.
Lastly, if we could just tell us the hours that people are able to get tested at these locations.
Certainly. So the two new community testing sites are running from 8 a.m. to 8 p.m. 7 days a week.